So good morning, everyone, and a very warm welcome to today's webinar. The topic of today's webinar is leveraging partnerships and networks in social prescribing. My name is Prab Sandhu. I'm the Healthcare Systems and Community Specialist on the Healthy Aging team at United Way BC, and I also lead our work on social prescribing across the province. I'm really looking forward to being your moderator today, and I'll be helping guide our conversation. Before we get started, I'd like to take a moment to ground us with a land acknowledgement. United Way BC operates across the traditional and unceded territories of Indigenous peoples throughout what is now called British Columbia. We honor and recognize the many territorial keepers of these lands, past, present, and acknowledge the ongoing connection that Indigenous communities have to the land, waters, and culture. As we talk today about community, connection, wellness, it's important to reflect on the leadership and resilience of Indigenous communities in this work, and to recognize that reconciliation is ongoing and requires meaningful action. So before we dive in, just a few housekeeping notes. So everyone will remain muted throughout the session. Closed captioning is available. Just click the CC button in your Zoom toolbar. It should be at the bottom or the top. And then we'll have a question period toward the end, but you are welcome to submit questions using the Q&A box anytime. Today's webinar is also being recorded, and both the recording and the slides will be shared afterward on Healthy Aging Core. So today's session is a part of our Conversations on Social Prescribing webinar series. This is a 4-part series running from March through June, co-hosted by United Way BC and the Canadian Alliance for Social Connection and Health. Through these sessions, we're aiming to highlight innovative work happening across BC and beyond, and to create the space for sharing ideas, challenges, and successes as social prescribing continues to grow. And just a quick note, our next webinar will be happening May 23rd at 10 a.m. Pacific time, focusing on primary care perspectives on social prescribing. And I hope that you'll be able to join us for that as well. So we're thrilled to be joined today by 3 wonderful speakers who bring a range of perspectives from frontline community connection to health system leadership. So first, we'll hear from Jade Hamilton, a seniors community connector with Nexus BC Community Resource Center. Jade has a long history of working with people across the life course, starting with over 20 years in childcare and now working to help older adults stay connected and thrive in their communities. She brings a deeply relational and participant-centered approach to her work. And then next we'll hear from Cora Leschert. Am I saying that right, Cora? Okay. Director of Programs at Nanaimo Family Life Association and a member of the Nanaimo Social Prescribing Steering Committee. Cora's background spans medicine, social services, and education, and her passion for social prescribing shines through in the way she champions the critical role of community connectors and builds bridges between sectors. And finally, we'll hear from Dr. Grace Park, a family physician, researcher, and founder of the Pacific Regional Network for Healthy Aging. Grace has been a true leader in embedding social prescribing into health system practice, particularly through her work at Fraser Health. And she's now working with United Way BC to help expand and strengthen social prescribing across the province, bringing a strong system and research perspective to this work. So each speaker will share a short presentation highlighting their experiences, lessons learned, and reflections on building and strengthening partnerships and networks in social prescribing. After we hear from all 3, we'll move into a Q&A where I'll start us off with a few questions, and then we'll open it to your questions as well. So with that, I guess I'll pass it over to Jade to get us started.
Hello, good morning. Share my screen. All right, you guys see my screen? Yeah, okay. All right, so I'm Jade Hamilton from the Nexus BC Community Resource Center, and today I'm going to be talking about the early adoption and creation of the online referral form that I created, working with the health authority and collaborating, other collaborations, and then conversations in the community. So the early adoption and creation of the online referral form, why I did this. When I first started this role, I realized very quickly that one of the biggest barriers to helping seniors efficiently was the referral process itself. I knew I needed to make it easy, and I needed to ensure it didn't take too much time. Referrals were coming through emails, phone calls, and even sticky notes. It was inconsistent, easy to miss people, and hard to track. So I wanted to ensure that it was easy for both the referring professionals and for myself to stay organized and to respond quickly. So I decided to create a centralized, easy to use online referral form using Cognito Forms. I chose this platform because it's secure, it was customizable, and it allowed me to route the information directly to my confidential list. So as soon as you guys push submit on here, it comes right to my email and to a list on the back end. I worked really closely with a few of the healthcare professionals who I was already getting referrals from, and I got some of their feedback, and then I built something that was really simple, clear, and quick to fill out. I included prompts that helped me ensure that I was getting the right details up front, things like basic contact info, presenting concerns, whether the individual had consented to a referral, and stuff like that. So I made it super simple and easily accessible. And then since launching the form, I was able to track referrals easily, prioritize urgent cases, and reduce back and forth communication. And it's been a pretty core part of how I work now. And like I put it super simple, so you could just put in some notes and things like that, and who the person is and who you are, so that I can always just come back and chat with you if I need more information. So working with the health authority and collaborating. I focused on collaborating because I knew that from the start, the community connector role would be, to be truly effective, I had to be visible and trusted by those who were working frontline in healthcare. So providers needed to know that they had someone to call when social needs were impacting a senior's well-being. So it did take some time and some community emergencies, actually, such as an apartment fire and a hotel fire and stuff, for people to see the benefit of what a community connector can do once in the role. So I had a few relationships with Interior Health because I work at a resource center. We already had some Interior Health people using some of our services for things like tax returns, some government paperwork and things like that. So I was able to open the door and just kind of explain my role to those people pretty quickly. One of the first teams that actually picked me up was the quick response team. They were really instrumental in spreading the word. They understood the value of social prescribing, and they were quick to refer and support me and to introduce my role across the health authority. I also reached out to a contact at the hospital. In my old position, I used to go there and offer information sessions to people who were in the hospital. So I just connected with that community resort or community contact and asked her if I could come there and do a presentation on what the community connector offers. So I was invited over, and we were able to do a presentation to them, and that led to the community connector actually being put into their intake package at the hospital. So that ended up being quite a big win. And then since then, I've had a lot of referrals come from different places, because originally I was only getting referrals from the quick response team, but now I'm getting referrals from nurses, discharge planners, social workers, but also from community-based physicians and clinics, which is also really awesome to hear. So that means that people are spreading the word. Doctors working in busy practices have been eager to refer patients who are isolated, struggling with housing or food security, or just need more support than the medical system can offer. So having those partnerships means that I can step in early before situations become a crisis, which often ends up being the case. So we did have to do a lot of collaborations with some other people in the community just to kind of make sure that people's basic needs were met. So one of the other collaborations that we did in town was we have a program called Turning Points, or a society called Turning Points. And I messaged them and told them that I was identifying some seniors in the community that had no food. So we partnered closely with the Housing Society, and together we created the Adopt a Senior Emergency Food Program. Basically, it's frozen meals that they were already making. It wasn't going to cost them any more money for them to offer them to me. So this program ensures that any senior in the community who is identified with being without food can get some immediate support. So Turning Points helps with the logistics, and then we use DoorDash, which is provided through United Way, to deliver those meals. And then that just makes the hugest difference, because the people who are getting those meals often aren't out in the community. They're not able to leave their houses easily. We've also partnered with the same place, Turning Points, for an emergency hotel room program. So I'm able to access those in critical situations. We've had people unexpectedly lose their housing, or people who have went to the hospital for an extended stay and came out and lost their housing during that stay. And so having emergency tools at our fingertips, like food and shelter, it really makes all the difference. We really can't offer social prescribing unless our basic needs are met. So it's really been very beneficial to have those in place. And then on a lighter note, some conversations that we've had in our community. So, well, I forgot to skip that one, sorry. So one of the things I love the most about this role is getting to know people. And in those conversations, whether with seniors, caregivers, or other community members, I kept hearing the exact same thing. I feel lonely. I can't afford fresh food. I miss cooking. I don't have a kitchen to cook in, or a kitchen that I can utilize well enough to cook the meals that I used to cook in. So that really stuck with me, and I wanted to create a space that wasn't just about survival and about connection, joy, and conversation. So we actually do have now 3 community gardens that we run here in town, and we were able to revamp a couple of those ones that were falling apart, and now we're able to use them for what we call the gathering garden. So it's got a space where seniors can come grow food together. And the idea is that they're gonna meet together every week, or possibly more, depending on how often they want to see each other. And they're gonna share the responsibilities of growing the food. And then at the end of the season, the idea is to have a harvest meal together. And so we have 10 seniors who are dedicated this year to growing for the season, and it's going to be led by the seniors, but we do also have a Canada summer job student this year, so she's going, or she or he is going to be able to help support that and get that going for them. So it's kind of really interesting. Out of that too, people were talking about how they'd love to have cooking classes. So now we're on the hunt to find a kitchen that we can offer cooking classes in, where people can take some meals home as well. So it kind of just grew. But it didn't actually stop there either. We have one of our seniors who is really, really, really into stained glass. She does it all the time, but she really wanted to offer like an intro course to people for free. But she just didn't know how to do it. She didn't know where to start. She didn't know where to do it. And so we have a social club here that we offer a lot of things like that. So we're able to work with her and come up with a workshop that she can lead for other seniors. And she even said that if that led to more things in the future, that she'd be really open to that. So these ideas are all rooted in what people have told me. I was just there to like facilitate and support them through it. So it's been really, really rewarding. I think I might have talked too fast, but I'll give some of my time to Grace.
Thank you so much, Jade. It's so encouraging to hear about how you built practical tools like the online referral form to make it easier for healthcare providers to connect, and just how you built those strong relationships with the health authority. I think it's like really great examples of how creativity and building on existing relationships can open new doors for collaboration. So thanks for that. So I guess now we can move on to Cora.
Awesome. Thanks so much, Jade, and thanks so much, Brad. I'll share my screen here. So I am Cora Leschert. I am the Director of Programs at Nanaimo Family Life Association. We are on the traditional territory of the Snuneymuxw and the Chenalis people, and we're really grateful to be here in our community. We've been in the community for a long time, since 1967. I am really delighted to be here today to share in the excitement of how United Way Community Connectors are making such a huge difference all across the province. I want to speak to some specific strategies that have been helpful in our region. And I also want to acknowledge that I am the Director of Programs. So we do have an incredible community connector at our agency. Her name is Amber Knapman. She does all of the frontline work with all of our clients, and she's been really instrumental in developing the systems that have helped to make us so successful. And then I get to do a lot of the speaking and the promotional meetings and going around to speak to all of our agency services with our different community partners. So we have a really strong partnership. We're really fortunate in our organization that we kind of are able to have those two levels in terms of both being able to provide a lot of that frontline support and also to meet with a lot of the community partners. So I really wanted to give some practical tips today in terms of how we've made that work and how you might be able to make that work even with an agency of a different size. So this slide is a little bit daunting to look at. I'm going to walk you through it. You heard in my bio that I'm part of the Nanaimo Social Prescribing Steering Committee. So we were really, really fortunate in our community that there were already a number of really passionate physicians and allied health professionals who were starting to engage in the social prescribing process. So I'm from the Island Health, Vancouver, the Health Authority. And so they were looking at some of the incredible work that Fraser Health Authority had done, really looking at some of the amazing work that was happening over in the UK and engaging with the Canadian Institute of Social Prescribing. And there was this real desire to bring this to Nanaimo and to figure out what this would look like. So the Social Prescribing Steering Committee is comprised of the Nanaimo Division of Family Practice that represents the family physicians and nurse practitioners in our region. There's representatives from the Island Health Authority, the City of Nanaimo, Vancouver Island University, and Nanaimo Family Life Association. And so the Social Prescribing Steering Committee received funds from Doctors of BC through Shared Care to put together a referral pathway within Island Health that could then be generalized to our region. And so a lot of the work that we've done over the last year is to develop this social prescribing process. And so I'll talk a little bit about what this looks like. If we start kind of on the top left there, you can see that PCP is primary care physicians, central health services, community providers, and other organizations, other allied health professionals, specialists, clinicians within Island Health are going to fill out a geriatric psychiatric referral, and we're going to request support from somebody within social prescribing, so a community connector. So they fill out a single referral, basically anywhere they come from, Island Health, they can do it in a family doctor's office, they fill out that single referral. That referral goes to CAS, which is Central Access Services. That is where a nurse from that team is going to call that client. They're going to explain what social prescribing is, but they're also going to assess for a general safety net of Island Health Services. So as Jade identified, a lot of our clients who come with us are socially isolated, but also have a number of other needs, especially as they start to begin that aging process. It's possible that they're going to need home care support or other services that are provided by Island Health. So this screening section basically ensures that not only are they going to get social prescribing support, but they'll also get support from other Island Health services. So then that central access service from that point is going to send the referral to a community connector. Now in Nanaimo, we're a little bit of a different situation in which Island Health has a link worker that supports medically complex patients. So these are our patients who may require more support with their activities of daily living. They might require more support to attend programming or aren't able to attend programming independently in community. And then at our organization, we have Amber as our community connector, and she is going to work with those clients to create a wellness plan that's tailored to them and then help them get out into community. And so This pathway, essentially, if we look at just the orange bubble, which is us, we get about 15% of our clients through this pathway. The rest of our clients come through our community. So that's word of mouth, that's other programs, other agencies, clients that walk into our agencies. And then Amber is taking the referrals from there, from other agency partners, and supporting those clients. So this pathway is important. We're so grateful for the support of Cheryl and Prab through the United Way in terms of helping to take this pathway and make it applicable to all Island Health clinicians. So if you're a community connector in the Island Health region, you can definitely connect with Cheryl about some information about what that looks like for you. This social prescribing steering committee also gave us some really fantastic relationships. So for you locally in your community, some of the more difficult places to get into might be your family physician's office or to meet with nurse practitioners. I highly recommend connecting with your division of family practice locally. They'll be kind of like your doorway into meeting with physicians and nurse practitioners. And coming from a background where I worked in a doctor's office, I can tell you that they know exactly what client you are talking about. These clients who come in and they're there on a weekly basis because their doctor's office is a safe, happy place for them. They know they're going to be cared for. They know that they're going to have somebody who's going to look after them. And so when you start to talk about social prescribing and the magic of social prescribing and how you as a community connector can come alongside the health system and provide support with that, that can make a huge difference. So highly recommend connecting with your local division of family practice. I also recommend getting to know your city. So many cities have a parks and recreation department or leisure classes or that sort of thing. For social prescribing week here, the city of Nanaimo in all of their different facility locations had pins that said, "Ask me about social prescribing," so that we could raise awareness about the impacts of social isolation and how much having kindness or taking time to meet with people or remembering people's names makes a difference. So we had a really big citywide kind of awareness event. Our partnership with the local schools and universities has provided us with fantastic volunteers and practicum students. So now with Amber, we actually have several third-year nursing students doing their practicum in social prescribing specifically. So that partnership can really bring more information to your community and more resources to you as well. And then I also recommend going around to pharmacies and counseling offices because similarly in pharmacies, it's often a first point of contact. Grocery stores and pharmacies are socially isolated folks who are looking for somebody to talk to, and that is a place where often they're ending up daily. So it's a really great spot to start to raise awareness for. One of the things that we found was really important in working with all of these community partners was being able to speak to tangible results. And so we developed an initiative. My team came together and we were like, how can we create a soft landing place for social prescribing clients? And we came up with the idea of kitchen socials. And so as we know, all good parties end up in the kitchen. So Kitchen Socials is a recipe demo class that people can come. They can either come and socialize and play cards and enjoy the lunch at the end, or they can come and they can learn a healthy recipe and everybody gets together and it happens on a weekly basis. So it meets both social and nutritional requirements. So this funding came from the Social Prescribing Steering Committee, and basically 2 weeks later, we hit the ground running and we have seen such incredible results. People really connecting with one another, making friendships both in and outside of Kitchen Socials, and seeing those carry into somebody comes to Kitchen Socials and maybe they meet somebody from our TAPS program, they make friends, and then they feel safe going to a chair yoga class. So it helps to really develop those community partnerships. It's also a really easy place to draw in community agencies. So we have a really great partnership with Nanaimo Food Share. They are the chef for our kitchen classes. We see students coming over from the university. We see a number of different allied health professionals really interested in how they can start to build community. And we even ended up doing a kitchen socials for the physicians in our region. So we brought them in, we had them cook together, and then we presented about what social prescribing is and what that's going to look like locally. And so that really, really had a big difference. As I mentioned, I do a lot of public speaking for social prescribing. This project just lights me up. It makes me so happy. And so I have some practical tips for how to leverage your community partnerships and help to build collaboration. The United Way has provided some really fantastic information, and I'm so grateful in that social prescribing implementation guide. If you haven't had a chance to look at that, highly recommend engaging with that. What I do when I'm around and when I'm talking about social prescribing is I talk about person that everybody knows, that ideal client for your agency. And this will be specific to the agency, the size of community that you support, and kind of the other services that you offer. But for us, like this is somebody who maybe lost a lot of their social support recently, who you just get the sense when you're talking to them that they need more time than maybe you can offer in your agency. This is what I say when I'm speaking to people. And I say that is the perfect referral to a community connector. That is the perfect referral to Amber, who can come and provide hand over hand support to access resources and reduce community barriers. I also like to have a really easy, how do I get involved answer when I talk about social prescribing. People are like, initiative, like how can I get involved? What can my organization do? What can I do as an agency? So I always like to talk about at an individual level, the magic that comes from building relationships with people, with checking in on your neighbors, with getting to know the people around you. And then from an agency level, I always say, well, we'll always take money and volunteers, and to give them ideas for how their community can create a community class, or how their agency can start to engage with this process. So this is really sort of tailored to your agency and the services that you have, but know the type of client that is the perfect referral for you, know how to get people involved, and then provide information that's specific to your agency that they can take back with them. So we created little pamphlets about NFLA services, specifically about social prescribing, and we give those out when we speak to that. And so, you can really take some time to make that your own, to speak to the magic that is happening in your community. So I thank you all so much for being here, and I'm so excited to see where this program goes.
Thank you so much, Cora. It's so inspiring to hear how you built such a strong network of partnerships across different sectors, and just how creative approaches like your kitchen socials are helping make social prescribing feel like welcoming and accessible for participants. Um, really powerful insights about meeting people where they are and building those connections in ways that feel wholesome and natural. So thanks again. And now finally, we will give the stage to Dr. Grace Park.
Hello, everyone. I'm just going to share my screen. Here we go. So we're going to change tact a little bit. I'm going to be speaking from our perspective from Fraser Health in the way we set up a system to try and promote social prescribing amongst the thousands of individuals that work in the health authority and the 14 communities that make up our region. So as you know, British Columbia is made up of 5 regional health authorities, and each one is a different color. Northern is big, and it's that light green up at the top. Fraser is at the left bottom in the southwest corner. And amongst all the health authorities, like everywhere actually around the world, the population is aging. And as we get older, we certainly face a lot of health concerns. And we can see the numbers of seniors growing over time. And so, yeah, so Fraser Health now serves around 3 million people, and we have about 300,000 that are over the age of 65 and growing. So social prescribing has come to our attention through the work in the UK in particular. We know that health is more than just clinical interventions, that people present to family doctors' offices, and social factors contribute to 80% of their health concerns. And older adults need support to age well, and we need to address their social determinants of health. And we have data coming out of Kent in UK, where 20% of acute care admissions can be reduced if social prescribing were in place. So in Fraser, we looked at how we can deploy social prescribing. We really wanted to address the social determinants of health and look at the barriers that older adults face when they want to live a healthy life, the physical barriers, the financial, the cultural, the psychological barriers that get in the way of them accessing community or supports and engagement, get in the way of being able to have adequate housing, good food to eat, that kind of thing. And we started our work looking at the frail population. How can we support people so they don't become more frail? And we know we have health services that support people that are living in their home and becoming more frail. And we deployed the Avoid Frailty strategy from the Canadian Frailty Network, it stands for activity, vaccination, optimized medication, interaction, and diet. And these are things that we can do at every stage of our aging journey. And the sooner you get started, the better to avoid frailty. And then we also wanted to address the social isolation by implementing the clinical guidelines that were set out for social isolation and loneliness by the Canadian Coalition for Seniors' Mental Health. And there's active guidelines for clinicians, for physicians, nurse practitioners, anybody working with older adults to try and raise awareness about isolation and loneliness and how that can be so detrimental to your health. And then we also wanted to look at what are we doing in the health authority and what further things can be done that we're not able to address in the health authority. And when we were working on implementing social prescribing, we wanted to have some basic principles, and we developed these actually as we sort of found our way, and we had nobody to really follow. So we developed our processes, and we wanted to have these principles in mind. So social prescribing is a community resource in Fraser Health, just like home health is, just like wound care is. Social prescribing is a health care service that anybody and everybody should have access to. We wanted a standardized referral form and pathways so that regardless of where one worked in Fraser Health, they can actually find a way to make a referral to the community where the patient lives. So we wanted to have all electronic medical records in acute care and community offices to be able to offer to refer to social prescribing, and depending on where the patient lives as well, and to set up those organizations in the community in partnership with United Way, which is a big part of our success. We also wanted a centralized intake and community referral allocation, and very similar to what Nanaimo Cora was talking about, but we wanted one that was regional so that anybody, regardless of where they lived in all 14 of our communities, they can access social prescribing. And through doing it electronically, we're able to access data and track referrals and make improvements along the way. So we were really fortunate in 2019 to partner with United Way to become a demonstration site as a health authority to develop social prescribing. And that year, there were 19 programs funded throughout the province, and we got a good bulk of them to deploy social prescribing in Fraser Health. And of course, through our demonstration project and the growth and the raising of the awareness, now it has expanded, and we're going from 19 programs to 100 community connectors by this year. So that was the outcome of our work, and really grateful for this journey with United Way. So the infrastructure to promote healthy aging is how we started in Fraser Health. We worked with divisions of family practice. These are the community physicians and nurse practitioners, urgent primary care centers, primary care networks where there's team-based care with physicians and nurses and allied practitioners. And then, of course, with United Way and their network of nonprofit organizations and community-based senior serving organizations. And then the community connectors that were hired in those community serving, senior serving organizations. And within Fraser Health, we worked with home care nurses, social workers, other allied health workers. We worked with geriatric emergency nurses in the emergency departments in all 12 of our hospitals, assisted living sites, and discharge planning in hospitals for seniors that have been in hospital for prolonged stays, and when they get home, and what sorts of things will allow them to transition back home successfully. And then the pre-elective surgery clinics for optimizing the health of older adults when they come in for surgery. Social supports are so important for their recovery after their surgery. So these are sort of some of the infrastructure pieces that went into developing the social prescribing scheme in our region. And then we recognized that there's other resources in the community already, and family doctors and nurse practitioners and home health nurses were already referring people to community supports like food banks and other resources in the community. And BC 211 has a whole repository of resources, as you know. And so if people are able to just take a name of an organization or a phone number, then that's what we call signposting or light touch social prescribing. So these are very minimal kind of intensive ways of helping people, just providing that navigation and information. So that was one side of things, but there are people that need a little bit more hands-on, the ones that are a little bit more complex, the ones that need a little bit of support to get themselves to a place where they can even think about how to bring joy in their lives and to improve their health. And so that's the big piece that we worked on within Fraser Health. And I'll talk more about that in the next slide. But in developing the infrastructure within Fraser Health, we developed the infrastructure by creating a change management team. And we developed a team with people that we worked with, people that I work with in the home health portfolio. We had 2 change leads that were nursing background. We had an operations director who can oversee the programs and allocate resources, nursing and allied health educators like OTs and PTs and social workers, pharmacists, a clinical nurse specialist who can also provide clinical support. And then we had help from the IT, the data people that could develop EMRs and help us to collect information to see if we're doing the right thing. And we had the communications consultants to help spread the word about the work that we were doing. And we had executive sponsorship with the executive director from home health and the VP of integration that really helped us to get that regional lens and oversight to be able to bring resources that we needed to work within the health authority to make sure that this was a regional resource that was going to be available to everybody in every community. And through this effort, the change leads going to different service areas and speaking to people and training the trainer about how to deploy social prescribing within their ward or within their setting. We had 126 clinical service areas come on board since 2019, and to date, we've had over 2,000 referrals to social prescribing in the communities where older adults reside. So if you look at the diagram that was in the previous slide at the bottom corner, you can do a self-referral. So older adults can self-refer, or their families or their neighbors can self-refer by calling the home health service line, and all the care providers in Fraser Health. So whether they're in home health offices in the community or in acute care in the hospital, or a family doctor in their office, they can actually go onto their EMR platform. And Meditech is one that we use in all the hospitals. There is an electronic referral form there. And once that electronic form is completed and sent, it goes to home health service line along with other referrals to home health and other community resources. So this home health service line is a big department that receives all these referrals from all the sites. And then they'll find out where the patient lives, do a little bit of screening and triaging, and then send the referral to the community where the older adult resides. And that's the last box on the right. So the older adult gets a call from a community connector, and then the host of resources that are in the community that the community connector is aware of is made available to the older adults. And depending on their need, the community connector may follow them for a period of time or just simply make that referral to the community organization. So it's a very comprehensive program, but really integrated between the health services and the community connectors, and really glued together from the work that we've done between the Health Authority and United Way to pull this system together. So the outcomes we've seen, not just in our region, but in other places where they've deployed social prescribing, we know that it increases the quality of life for older adults when they get involved with community supports and resources. They have shown decrease in healthcare utilization, like emergency room visits, and decreased length of stay in the hospital. And then increasing awareness of the resources in the community to create that community cohesion, create volunteer experiences and opportunities, and to bring the community together. And that was really the purpose of our social prescribing scheme in our system. And with the success that we've demonstrated in Fraser Health, we actually got a mandate from the region and from the ministry actually to improve transitions, to make seamless transitions for seniors as they had the healthcare journey. So we developed the frailty pathway, which allowed our clinicians to identify the level of frailty the person is suffering with. And depending on that, refer to the appropriate community, home health, or hospital long-term care resources. So along the top in the orange line, we see the healthy, the pre-frail, the mild frail, doing an assessment, and that's done by our community or resources like the nurses or anybody else referring, like family physicians as well. And then along the bottom, you have the spectrum of services. So community services like social prescribing or the rec center or other resources that you can do with just signposting, all the way to, as they get a little bit more frail, the reablement after hospitalizations, the day program for older adults. And then if they become quite frail, the home support services that home care nurses, other supports that are provided already in the health authority. So this integration then allowed us to insert social prescribing as a spectrum of resources and services for older adults as they age, depending on the level of frailty and the need that they have. And this is the way it used to be. I think I've got a few minutes I can talk about this. So family physicians at the bottom would see a person who was vulnerable, needing some help, and they might refer to the primary care network, where there's a team-based model with nursing and social work and pharmacy, etc. They make a referral, and traditionally they would only have home health services to refer to. And home health really looks after people that are moderate to severe frail, so they're already needing support with personal care and dressing and feeding and toileting, that kind of stuff. And so we know that there are a lot of people that are less in need. So the pre-frail patients that are less frail, but they need a little bit of support and they need to be followed as well because maybe they're socially isolated. So the new frailty pathway they've developed is we actually have the referral coming from family physicians and nurse practitioners again to the primary care network, and we've created a whole new position called the healthy aging nurse. And she does a comprehensive geriatric assessment to see their cognitive health, psychological health, functional health, physical health, and social health. And if they have social health, social vulnerabilities, they get referred to community, and social prescribing is right up there. And then the care plan is developed with the older adult and their caregivers, sent back to the primary care physicians, or if they need further help from health authority, then they'll get referred to home health as well. So again, an integration of the need for those people that are less frail all the way to those that are more severely frail. So all this to say then that we are working and are really developing and really trying to emphasize that the community is where health is. We're not an illness-based system, we're a wellness-based system in social prescribing. So health will always have a role, but a small role over in the corner for when they need that, like the acute care system, the hospitals. But housing is hugely important, activity and exercise, culturally appropriate services, community services, education, clean environment, transportation, all of the things that we always talk about when we have an older adult in front of us with these social needs. And that is the end of the presentation. Thank you so much for your attention.
Thanks so much, Grace. Thank you for such a wonderful presentation. It's really powerful to see how Fraser Health actually built an infrastructure around social prescribing, from standardized referral pathways, EMR integration, the centralized intake and ability to track outcomes over time. Your leadership in helping bring together the clinical teams, operations, and community organizations has clearly been key in supporting that work. And it's really exciting to hear how partnerships with health and community, whether that's with us or other community partners, has really helped expand this model even further. And it makes it possible to connect more adults or older adults to supports they need to stay healthy and independent. So once again, thank you so much. And thank you again to all three of our presenters, Jade, Cora, and again, Grace, for sharing your experiences, insights, and the practical strategies that have helped move this work forward. So with all of that in mind, I want to open up the conversation a little bit more. I'll start us off with a few discussion questions for the panel, and then we can open it up to you, questions from the audience. So with that, let me get started with the first question. So what advice would you give to organizations that are new to social prescribing and looking to build trust with partners? And feel free, anyone, any of the panelists can go ahead and answer.
To jump in. First of all, if you are new, welcome. You're in good hands because the United Way has really, really excellent supports for new organizations, this webinar series included. My advice for how to start the process of creating those community partnerships is to go around and start to meet the other agencies and partners in your community and exchange resources, exchange information, invite them to speak. Ask them if it's okay if you come and see what some of their programming is like. Start to build those relationships. And from there, you start to meet who your people are and the other agencies that are serving a very similar population to yours, or who are seeing a need that they can't serve, that you can. So I think relationships is at the foundation of how to start this work.
We also have like a community newsletter that goes out. And so I always, beginning of being a community connector, I put in a blurb about me. And then I do every couple months, I put in a blurb about the community connector and what we offer in the community and things like that, just so people are aware of me on top of me doing the groundwork, right?
And just to add to that, the local division of family practice, if you have a contact, it's really wonderful. If you don't have a contact, find a way to make a contact, to build a relationship, because they have a way of spreading information to their membership. And their membership may be made up of 50 GPs, or it could be 300, depending on where you live. And so your message will get out to all those community family doctors and nurse practitioners. And so that would be a powerful way of raising the awareness. And I think all the work that, you know, the National Organization on Social Prescribing has done, CISP, and now everybody's talking about social prescribing, there is now a growing awareness. And so when a family doctor gets a newsletter from their division, they will look at this. Oh, this is social prescribing, and how do I do that? And so there is going to be an interest.
Thank you so much for all three of those answers. And building on some of what Grace just mentioned, what are some practical strategies or some examples, particular examples of practical strategies that you would suggest community organizations use in order to build those relationships with the healthcare system? And I know your presentations included some of those. If you want to, refer back to those or expand on that, please feel free.
I really do think it just comes down to the groundwork and using the people that you already have a connection with. They might not be the exact person that you need to be connected with, but they can direct you to the right person that you need to connect with. And once you find one person that can get you into the right circle of people, then the information spreads. And then from there, other people are looking for you. So it doesn't take very long, but I think it really does come down to the groundwork and not just like a spiel that you're reading off a piece of paper. Like, really know your job and know what you're offering and things like that, because then when people are asking you what you do, you're not just saying the same thing over again. You can kind of modify it depending on your audience. Like, it might be a little different if it's the physicians you're talking to. It might be a little different for the nurses at the hospital compared to the nurses in the community compared to a community-based agency. So just really knowing who your audience is and really making those connections and the groundwork is really important.
And I think too, if you can connect with your local hospital, with the volunteer services department, or a social worker, if you're able to get somebody from the social work department to have a few minute chat with you or drop off something with information on social prescribing. It really is just about getting that information into their hands, because they will be aware most likely of social prescribing. And if they know that now it's coming to their community, they will be able to help you. And so I think just that groundwork and meeting with people, just meeting them where they're at. So social work, volunteer services, emergency department. If there's a social worker that works in the emergency department, I think would be a really great contact as well. And then divisions of family practice all have a website. And so you can even send an email to the website and see if somebody will respond.
absolutely. I agree with all the points raised. And also, talking about pharmacists in your community, right? You start to spread the word there, and they really have that frontline time that they are spending with a lot of these clients, and they start to spread the word for you as well. And so absolutely, I think the key when Jay talks about knowing your audience is talking about how you are coming alongside and you are supporting. So that lets healthcare focus on what healthcare is there for, and that community can provide the supports that community is so amazing at providing.
Thanks again for all those answers. So I'm going to move on to my third and final question. And once again, you can type in your questions in the Q&A box. It should be at the bottom of your screen or in the chat as well. But my final question is, once those relationships are established, what have you found are some effective ways to keep them active and meaningful over time?
Sharing the magic. I can't tell you what it means for some of these other agencies and for referring physicians to hear the difference that their clients are experiencing. So we, collect impact statements whenever we get a referral. We always ask about follow-up, what kind of follow-up people want, and for people to know that, like, we had somebody who was referred to our agency through a physician, and they followed up, and Amber was able to be like, well, now they're taking dance lessons once a week, and they took a cheese making class to the city last week, and just for people to know that the people that they are referring it are cared for, that they're building relationships, they're re-engaging with community. That's where you really start to see that impact, where then you're getting more referrals and you're getting more engagement from community partners, because they know, just in the same way that you know that this work makes a difference, they get to know that this work makes a difference.
Yeah, I think willing to meet with people and share your stories is really hugely powerful, as Corey just said. But I also think that if you can build on those relationships, try and have some regular sessions with people, whether they're other agencies or whether the Division of Family Practice or a community table where they come together to talk about care for seniors and other groups, where you can come and tell those stories to a wide audience and do it regularly. Is hugely impactful. And they just need to know that they can bring this up at the next meeting. And so having sort of offering yourself to be at these gatherings on a regular basis, I think would be really helpful too.
And I think just making yourself be accessible. I mean, I like all of the contacts that refer to me throughout the community have my cell phone number. I have a work cell phone. So, I mean, they can even shoot me a text message or phone me anytime, and they know that. So it's not like I'm very hard to get a hold of. They don't have to email me and wait for the day or two to get in touch with me if they have a question about one of the people that we have a mutual client with, kind of thing, right? So just knowing that they know how to connect with me if they need to, and I know how to connect with them, even if I have a question that's outside of the box kind of thing and I just need some guidance. Just making sure that they know how to get a hold of you easily. So just being available.
Thank you so much for all three of those perspectives. That is all of my questions, but we do have a few questions in the chat in the Q&A box. So let's just jump over to the Q&A box. We have one question. And Cora, I believe you touched on this already, but the question is, and this is from Stacy Dawes. She says, thank you to all the presenters. For those seniors who are linked with the Community Connector or Navigator, do you offer a feedback loop with the healthcare provider that has provided the referral to build cohesive communication and ongoing support?
I would say I definitely do. Once connected to, like, say, a social worker, unless that social worker is closing that person's case for some reason, I'm definitely connected to the person who's referred all the way through. And then like they go in teams, so like I'll get one team and then the next team. So they're always keeping up on that, and so am I on my end. So I would say yes, for sure.
We have been trying really hard to ensure that the referring source gets a feedback memo. Sometimes it's hard because if they're referred from acute care, the staff that made the referral are gone because they rotate. But we always have a room for referring or a note to go back to the primary care provider, because we know that all health records will go back to the primary care provider. And so we're trying to emphasize the importance to our connectors of that feedback loop and how that generates continuing interest in the social prescribing program, and also garners that support from the healthcare professional to continue to support the older adult in whatever, engagement that were made in the community. So connecting back to the primary care provider, I think, is really important.
Yeah, again, I echo both. I think one of the trickiest parts of developing a referral process is the confidentiality between island health systems and community agencies, right, in terms of providing that feedback loop. So we have, very similar to Jade's strategy, really made sure that anybody who's referring knows how available Amber is to respond if there are questions. And then that's a piece that we're still strengthening, is ensuring that that feedback loop is there. Recognizing that physicians only have so much capacity, but also wanting to provide that, like, hey, we've got them, they're with us kind of feedback.
All right, so now we're going to move on to the chat questions. So the first question is from Nancy Warren. What is the best way to reach isolated seniors that may not use a computer or even have a phone and are not yet part of the healthcare system, pre-frailty?
I'll start. It will be their primary care provider, and hopefully they have one. If not, then it's getting the message out to the community that social prescribing is available and that people can refer themselves or their family members. And so just raising the profile of your service, I think, is really important. And then if you've got a primary care provider, then they're seeing these pre-frail people because they're not yet meeting the requirements for home health support in the health authority, but they're seeing them for the medication renewals and chronic conditions that they might be suffering. And along the way, they are recognizing social vulnerabilities as well. And so primary care providers are really well positioned to identify people that would benefit from your service.
And I would follow that up by saying that if you don't have one and you're being identified in the community, it's probably because you ended up in the hospital, or a neighbor has identified you as needing more supports, or you need home care and that's being set up for you. So it's usually like the quick response team or the hospital that would identify that, unfortunately. So keep your eyes out for your neighbors.
Absolutely. I think both raising really great points. We have a ton of unattached clients in our community. I would probably say 80% of the clients who come through social prescribing in our agency do not have a family physician. And so they are coming to us through other agencies, through social workers, all of those sort of things. And so when I talk about being able to speak to specifically what your agency does, that kind of ideal client for a referral, and then never miss an opportunity to talk about social prescribing, basically anywhere that I'm at. I'm talking about social prescribing and the difference that it can have, because you never know who's going to hear it, that's going to think of, we all have people like this in our lives. It's amazing the referrals that we get where you would think that that person is well resourced, that they have everything that they need, and somebody's bringing forward their parents or their neighbors, and just needing that support that the community connector can provide. So never miss an opportunity to talk about what your agency and what your community connector can do and the services that you provide.
Yeah, thank you. I'll do one final question in the question and answer box. This one's from Deborah Patak. Thanks for this amazing presentation from Deborah. Jade, you mentioned creating the online form to make referrals easier to make and smoother to work with for all involved. What are some other ways that you or any of the other speakers think that technology could be used to make your job easier so that you have more time to focus on the client and partner relationships? And just for some context, they're a researcher and designer of digital tools looking to help in the social prescribing domain, especially focused on supporting persons experiencing memory challenges, dementia, and other support systems like family carers and others.
Well, I'd say as a community connector, one of my biggest challenges is keeping up on paperwork and case notes and things like that. Having all my information with me. So one of the things, my husband is actually going to school for computer science right now, and he's creating me a database that will basically do everything that we need for reporting. So, I mean, you could use technology in a lot of our jobs. It's just, we just need to like make it exist or use what's already there and just make sure that you're understanding the security features of all of it. But yeah, eventually I hope to have a database that has people's information in it so that I can access where I am and put in case notes where I am and things like that. So that's coming soon, hopefully for us. We'll see how it goes. But yeah, I mean, the more you can use technology and the less you can take, or more you can take off of your plate so that you can spend more time with the clients, because that ultimately is what your job is for the clients, right? So I'd prefer to spend more time with the clients over the paperwork side of things. But although that being said, I can't not do the paperwork side of things. If I were to leave tomorrow, the next community connector needs to know all of the stuff that I need to know. So yeah, I think that there is a lot of advancements we can do in that side of things just to free us up for more time for clients or participants.
Community assets is one area where I think technology can really help us. You know, for the referring connectors or even family physicians that want to know what's available in a person's community, or even for the users themselves, older adults with their caregivers, their adult children can look up in this community, where can I get access to, you know, food delivery. So we have resources like that, like 211, and if it's more health related, 811, and family physicians have pathways as another form that they can go on and look for resources. And now they're actually working together to develop an updated resource list in every community in the province, and so that everybody's working off of the same kind of list of resources and not having to continue to update within their own little communities. Because the problem is these resources can come and go and nobody's updating them, or it's outdated. And so having a provincial list of assets in each community, I think, would be really helpful.
Thank you, Grace. Okay, so that brings us to the end of today's webinar. A huge thank you again to Jade, Cora, and Grace for sharing not only their experiences, but also such practical insights and strategies that we can all take back to our own work. And thank you to all of you for being here and contributing to the conversation. I feel like it's through spaces like this that we keep learning from each other and strengthening social prescribing across our communities. And then just as a reminder, today's recording and slides will be shared on Healthy Aging Core. And I really hope you'll join us again for our next webinar series, Primary Care Perspectives on Social Prescribing, and that will be happening on May 23rd at 10 a.m. Pacific time. Thanks again, and everyone enjoy the rest of your day.